like to call this Health Committee meeting to order. Majority Council, would you call the roll, please?
Sure, Mr. Chairman. Ray Joyce and Sean Ward are excused this evening. Reedy?
Here.
Peston?
Here.
Collins?
Here.
McLean Lane? Here. Miller?
Present.
Moriello?
Here.
And Willingham. She's here, we see you. Seven present.
Thank you very much. Okay, first order of business, can I get a motion to approve our previous minutes?
Second.
Second by Mr. Miller. All those in favor?
Aye.
All right, thank you. Number 2, amending resolution number 258 for 2018 regarding the tobacco enforcement program. Dr. Whalen?
Good evening, everybody.
Okay, so this agenda.
Let's see. Our first one is the state has notified us of its intent to issue a 12-month extension of our tobacco enforcement program. This program and these funds are used to enforce the Adolescent Tobacco Use Prevention Act. So we have inspectors going out to retailers and with underage kids to try to purchase cigarettes, and also Clean Indoor Air Act complaints and enforcement.
Thank you. Any comments or questions? Mr. Moriello?
Just a quick question. As far as the agents going out with the underage people who purchase cigarettes, how often do they catch retailers selling cigarettes?
Yep, so for 2022, and keep in mind our numbers might have been a little bit lower for 2022 than they are other years, there were 240 ATUPA checks and 8 violations.
In Albany County?
Yep.
That's not too bad.
Mr. Miller?
Yes. So I love seeing this, obviously, Dr. Whalen, this is a passionate issue for me. As most people know, and I get tired of hearing it, I spend my days in a building with teenagers right across from the bathroom.
Yep.
I was just telling council, just today alone in a locker, we pulled 4 THC vapes out of one locker.
Yeah.
We've had to shut our bathrooms down, like you've seen in the news. We have only 2 bathrooms open now. This is a major problem, so
It
I love
absolutely
seeing
is.
this for sure. Frank, you got the question I was going to ask mostly, which was, do we have any kind of reporting on how we're doing on these things? So we know we have a store right down the road from us that keeps doing it over and over and over.
Yep.
I know it's difficult for you guys. Do we have enough kids in the program, the minors, to do that? Because I know after we had the kids come talk to the legislature, my students, we did get a call saying, hey, get us some people. Do we still need that?
So I'll have to check and see whether we have any openings now, because they turn over pretty frequently. But we have had challenges in the past with kids that are willing to do this kind of work.
Yeah.
Of interest, the second part of this program involves Clean Indoor Air Act, which I think you know prohibits smoking inside indoor public and most private spaces. But in 2017, that was amended to include vaping. So kids that are smoking or vaping in school grounds or properties are in violation of the Clean Indoor Air Act as well.
We found also 20 different, in that same locker room today, there were 20 empty boxes. So the big question is obviously they're underage, where are they getting it? That's the hard part, and that's what hopefully this will address. Can you just sort of help the committee understand too, because I think I learned this after last time, was what your role in this whole process is, like in terms of the health department. Like you can go in, if I understand it correctly, you can go in, you can bring the minor, you can find the violation.
Yep.
But that's about the limit of what you can do. You report it, correct? Is that what happens? It goes to, you can't like shut the company. You can't shut them down if they keep violating, in other words.
So we can find them.
Okay.
We do find them.
Yeah, but you can't shut the business down. That would be, the way I understood it was that like taxation and finance has to do that because they do business like
Yes, we work with them.
All right. I think that's an important thing for people to understand too, because you guys can go in there, you can find them over and over and over, but they keep putting it out there.
Yeah.
It's not on you guys to do it, but we do need help getting that done.
I'll just note on that I had a business in my district that was a repeat violator, and I think the state they suspended their lottery license for an amount of time, which was a pretty serious, it's a fairly serious punishment for repeated violation. I don't know if that's the norm, but anyways, my own experience. Ms. McLean-Lane.
We recently had an issue over at Blessed Sacrament School where a transaction between a 5th and a 6th grader for vape cartridges or whatever. And they were obtaining these things from, I believe it was a sibling. And so, you know, and one of those things, it's hard to stop, you know, when you have someone in your family who's buying it for you, who is of age.
Yeah, it's a tremendously growing public health problem, and it is specifically upsetting considering we have made such inroads in terms of smoking and teen smoking. And what we're finding is that people that start off, nicotine in any way you deliver it is an unbelievably addicting substance. So if kids start off vaping, we are finding that a lot of these kids are now going on and starting cigarettes. I mean, it's just tragic. And yes, to your point of 5th and 6th graders, it's getting younger and younger. I know I started hearing it with my kids when they were in 6th, 7th grade about problems in school and people vaping. It is ubiquitous, and it is really problematic.
Terrible.
Yeah, I just wanted to finish up just to say thank you for your efforts that you're doing. Please, you know, keep pushing on those for sure. I mean, I want everybody to understand again that smoking was gone in schools. We didn't have to deal with it. And then this came up, COVID slowed it down, but it's really back, raging again. And that's, you know, it's just, let the school teachers be the canary in the mine for the community, right? That it's bad, it's really bad. And we're sending kids out because now they're vaping stuff that's beyond just the nicotine. And we sent a kid out yesterday, we had to shut the whole school down to get a kid in the ambulance because they took something that wigged them out. So, you know, people need to hear it.
Yeah, and enforcement is important, but of course, education is more important to let these kids know about the harms.
Mr. Bergdorf.
I'm just curious, this is a tangential issue, but do you see any linkage between the legalization of marijuana and people smoking again? Because I'm listening to Matt talk about how cigarettes and smoking weren't a thing, and now all of a sudden, not only are you encouraged to open a marijuana store, but they're lottering them off the licenses, and there are signs everywhere, and people are being encouraged to buy and support the state. And to me, you know, smoking is smoking.
Yeah. And, you know, I think that if we look at other states, I don't know whether there's an increased risk of cigarette smoking from associated with legalization of marijuana, but I can certainly look that up. But what I will say is that, you know, in many of these legalized entities, they are selling vape cartridges for marijuana. So kids that are familiar with how to use a vape cartridge may become familiar, you know, might not be that much of a leap then to utilize it for marijuana. And when you're talking about dab pens, they call them, which is high concentration of marijuana, those are particularly problematic because we are starting to see with the high concentration of marijuana found in dab pens, a higher association of mental illness, including schizophrenia. So these are all public health concerns that we're just starting to learn more about, but it is concerning. It's certainly concerning.
If there are any other questions or comments, I'll take a motion.
I have a lot of comments, but that's good. Make a motion.
I'll second.
Seconded by Mr. Collins. All those in favor? Aye. Thank you. Next, amending Resolution 440 for 2022 regarding closing the gap with social determinants of health grants.
Thank you. So this is a grant that I think we have been here to discuss with you before, and we're looking for a 6-month no-cost extension. This is a grant that involves a lot of collaboration with municipalities, and in addition to that, the fact that we have had some staffing turnover, we do need a little bit of an extension. We're progressing nicely on the grant deliverables, and I think we're in a good spot, but this will help us to get the work completed.
Ms. William.
Okay, so if I'm to understand this correctly, this is the enhanced policies that promote walking?
Yeah, so it's not just about promoting walking.
Could you just speak up just a little bit, please?
Oh, yes, I'm sorry. So this grant is what it asks is for municipalities that are awarded grants to look at 2 areas that address the social determinants of health. And as you know, the social determinants of health look at where people live, what their economic background is, what their barriers on a practical level are to obtaining health. And one of the important barriers so our chosen areas of focus are 2. The built environment, and what built environment means is looking at an environment where people live, work, and play, and is that conducive to physical health? We know that people that live in areas where they cannot get out and walk, and where they cannot bike, where they cannot consider those kind of commutes to work back and forth, are associated with worse public health outcomes. In addition, the second focus on this grant is going to be on clinic-to-community linkages. So that's making sure that people get linkages to health where they need it.
Who are the outside agencies? That's what it says here. It says to partner with outside agencies.
Yep, so the department has partnered with many, the municipalities of Albany, Cohoes, and Watervliet. They're working with the Capital District Transportation Committee and many other partners, including St. Peter's Health Partners, Albany Medical Center, Capital District Transportation Committee, Albany Housing Authority, American Heart Association, and the Boys and Girls Club. They are all forming a coalition together to discuss the deliverables of this grant, to create what's called a complete street symposium, and get what's called an accelerator plan ready to go. So within these municipalities, they're looking at creating frameworks that can help improve health.
No other questions or comments, we'll take a motion. Mr. Miller, seconded by Mr. Beston. All those in favor? Aye. Number 4, amending resolution number 371 for 2020 regarding the 2020 State and Homeland Security Program grants.
So this is more about the same grant, and this is a contractual authorization with the Capital District Transportation. Oh, sorry, if I got them on the wrong order? Oh. Okay, sorry. This is the 1-year extension for the State Homeland Security Program grant. This is through our preparedness sector. It is a long-standing grant, and we are just looking for an extension to complete projects that support efforts to prevent and respond to bioterrorism. And we have had a significant staffing challenge within that division. We are down to just 2 people right now. Some of the reason that we're asking for this is because we had to put these planning activities on hold while we were responding to both COVID and MPOX. There was a tremendous amount of planning, and as you know, we've had a lot of community vaccination clinics, and so that took a lot of time, and the second consideration was the staffing. So we're requesting a little extra time for that.
Mr. Moriello.
What are some of the programs that are being funded?
So within, and let me just, so I am in the right spot. What this looks at is how we establish better infrastructure for cybersecurity. So it's working with IT. It is also enhancing the citizen core that we have that is primed for response to public health emergencies. And it's also how we create plans. So it's enhancing formation of preparedness plans.
Ms. Willingham.
Thank you. All right, I'm looking at this term here, citizen core councils. Mm-hmm. So how many, if there are any, and who sets them up, and how do you find out about them, since it has to do with the good citizens?
Right, so we have a very active medical reserve corps and a citizen corps, and there's a lot of information on it on our website, and through our strategic alliance, that information is also disseminated to the public. They were very instrumental in our COVID response, because we needed not only vaccinators, but we needed greeters. We needed people that were going to say, go this way, go that way. People to watch people once they were sitting down, usher them to go out. So those are some of the things that the Citizen Corps can do. And it's really important in public health response, because we could never have manned the response that we did during COVID without the help of our volunteers.
So it says here that this is a project that's not complete. So you said the Citizen Corps Council is up and running now?
Yes.
And what do they do now?
So they don't do something every day. They're just, we have them trained and ready to go, so that if we, in the eventuality that we do need them, we can reach out to them.
Sort of like FEMA?
Yeah, a little bit.
Yeah. People
Yep.
do, yeah. All right.
Take a motion. Mr. Miller, second by Mr. Collins. All those in favor? Thank you. Next, authorizing an agreement with the Capital District Transportation Committee regarding the development of a complete street symposium.
So this is, again, hearkening back to that closing the gap with social determinants of health funding, and this is to have a contract authorization with the Capital District Transportation Committee to convene a complete streets symposium. And what this does is convene an important group of planners that can look specifically at neighborhoods and how we can make changes in infrastructure to help promote health. We had a similar activity in 2016. And what resulted out of that was in the city of Albany, there was the bicycle and pedestrian master plan, and some of you who may travel up and down Madison Avenue on a daily basis will note the changes that has occurred there. And Cohoes and Water Valete planned complete street policies. So what we're hoping that the outcome of this will be are specific strategies, again, to implement bicycle and pedestrian master plan, and connections with the Mohawk Hudson Bike Trail, etc.
Mr. Moriello.
It sounds like a lot of this was done in the urban areas. Any areas you're looking at in either the suburban or hilltown areas?
So with this grant, you had to focus on particular municipalities, and they used criteria related to the Social Vulnerability Index, which is a CDC set of criteria that you look at a specific area and determine that people have poor health outcomes, and these happen to fall within our urban areas, so that's why these neighborhoods were chosen.
Okay.
I'll take a motion. Mr. Miller, seconded by Mr. Beston. All those in favor? Up next, authorizing an intergovernmental agreement regarding the Albany County Department of Health Social Determinants of Health Accelerator Plan.
So this is, again, the same grant, same objectives, looking at coordinating with Albany, Cohoes, and Water Valete. So it's just to come up with the contracts for them to work with them.
There's no questions. I'll take a motion. Mr. Miller, seconded by Mr. Beston. All those in favor? And next, authorizing an agreement with New York State Department of Health regarding public health strengthening infrastructure, workforce, and data systems funding.
So this is new funding. We're requesting grant acceptance and contract authorization, and it is something we're excited about. It's CDC funding passed through by New York State Department of Health, and it's monies that will be awarded over a period of 5 years, about $177,000 per year, and it is for strengthening our infrastructure and the public health workforce.
I'll take a motion.
Motion.
by Ms. Willingham, second by Ms. McLean Lane. All those in favor?
Aye.
All right, thanks for your time, Dr.
Thank you
Whalen.
very much.
Good evening, Mr. Reedy.
Evening, Dr. Giordano. Next item, authorizing an agreement with Mallinckrodt PLC regarding New York opioid settlement funds.
I think you pronounced that right. We had to Google that to see how it was supposed to be pronounced.
Thank you.
Yeah, indeed, we're here tonight to request permission on behalf of the county to accept a one-time distribution of $24,862.96. I was here last month talking about the county-specific distribution that's coming to us from the Opiate Settlement Fund. It all stems from the Attorney General's settlement across many different cases. As I said last time, there's $1.6+ billion over the next 18 years. This particular payment is from a $58 million settlement that the Attorney General had with Mallinckrodt. It's one of the largest opiate manufacturers in the country, and it's called a direct-to-subdivision payment. It's a one-time payment to Albany County, and it will go with the rest of the opiate settlement money ultimately to be distributed.
Mr. Moriello.
I do, one big question, I guess, is what I have here.
Yes, sir.
We, as you know, we sent you a letter from our conference, because our conference is very much in support of taking these funds and using these appropriately. One of the things that we're very concerned about is the opening of any type of safe injection sites. And here under Schedule C, approved uses, Part 1 treatment, under number 9 here it says, syringe service programs and other evidence-informed programs to reduce harms associated with intravenous drug use, including supply, staffing, space, peer support services, referrals to treatment, fentanyl checking, connections to care, and the full range of harm reduction and treatment services provided by these programs. Would this also include safe injection sites?
We did receive your letter, and this is what I can tell you. The governor, at this point, has said safe injection sites are illegal.
Okay.
The giving of the Safe Needle program, that's been in Albany for the last 25 years, and Catholic Charities runs that program. We don't need another one. So if you're asking me if this money will go towards any of those programs, on the first count, at the current time, there's absolutely no possibility because it's been deemed illegal. And on the second point, there's already a program operational doing the needle exchange. So.
Okay. That's what I wanted to know, because I know we have the methadone clinic here in the county, and it's created a lot of problems in that neighborhood. And a lot of the people that take advantage of that clinic are not county residents. So I just wanted to bring that to everyone's attention. Thank you.
Yes, sir.
Any other questions or comments? I'll take a motion. Mr. Beston, second by Ms. McLean Lane. All those in favor?
Aye.
Aye. Thank you, Dr. Giordano. And I will take a motion to close our committee meeting.
Got it.
Mr. Moriello, second Ms. Willingham. All those in favor? Thank you, everyone.